Health alert and the flu virus really spreading in Oregon and Washington. In fact, 2 children from Oregon under the age of 10 have died from it.
Well, so tonight we're looking into what you need to know to protect yourself and loved ones. Our Lisa Balick is here now with more, with some important information.
Yeah, Dan, I spent time with several doctors today and found out getting a flu shot is still a lot more effective at preventing the flu than you may think, but there are definite signs when you need to get immediate help.
I never really have in the past, and I just been kind of lucky, I guess. So
just because I'm a student and I didn't really have the time to go and do it, or also the money.
In Oregon, less than half the population has gotten a flu shot, say state health experts. But it's not too late, especially when you find out more than 6,000 people in Oregon have gotten the flu this winter. Hundreds are hospitalized, and some have died from complications.
And it can be hard to predict who's going to have complications, even though we know that, very young, very old, and medically fragile are highest risk.
Hundreds of people have headed to the ER with flu-like symptoms, breathing difficulty, high fever. When a cold comes on, it's gradual. The flu hits suddenly, and you feel like you can't even get out of bed. The shot is the best prevention, as well as hand washing and staying away from people who are sick. The flu strain we're seeing the most here in Oregon is H1N1. Some people wonder, how effective, though, is the flu vaccine?
The numbers I'm seeing are like 30 to 40%, which is pretty typical for the flu vaccine. So again, no one is going to claim that it's a perfect vaccine, but it may be just enough of that risk reduction in terms of people getting sick, spreading it, and getting the complications.
I asked Oregon health experts, when should you seek immediate care?
In particular, if people are having real severe problems with shortness of breath, or if you have a child and the child is having trouble with breathing, then that's a good time to make sure to get in to see a healthcare provider.
Now, as far as getting that shot, first check with your employer because they are offering free programs. A lot of folks are. Also, pharmacies offer the shot. There's also something called the Coalition of Community Health Clinics that offer low-cost shots as well.
I had my shot, didn't hurt, just so you know. Thanks, Lisa. All right, Democrats in